Welcome to this video on RSV in older adults. First, let me introduce myself. My name is Lieke de Frankrijker and I'm a pediatric infectious disease specialist working at the Wilhelmina Children's Hospital in Utrecht in the Netherlands. I did research on the interaction between RSV and bacteria, especially in cystic fibrosis patients. But other than working as a doctor, I am also a mother. These are my twins, Seteonos. They were born prematurely, but now at the age of 6.5, they are almost as tall as I am. So, we'll talk about RSV in adults over 60. In recent years, it was found that RSV not only affects infants, but also adults over 60. It turns out to be an important cause of pneumonia in adults over 60. But for many healthcare professionals, awareness is still lacking. In recent years, we have increased respiratory virus testing after the COVID-19 pandemic. So more and more we know that it is actually RSV that also plays a role in this age group. So what is the burden of disease of RSV in adults over 60? We know that every year between 3 to 6% of all adults over 60 become infected with RSV. And in 2015, 1.5 million episodes of RSV infection was documented in high-income countries. And it was estimated that around 336,000 hospital admissions occurred, which is 1 every 2 minutes. So possibly the disease burden of RSV is similar or even more severe than that of influenza. What are the risk factors of getting severely ill from an RSV infection? The age over 60 years old and even higher above 75 years old is an important risk factor. And also those with severe underlying diseases like heart failure or lung disease, COPD, asthma, or those with a weakened immune system, for instance, patients who are undergoing chemotherapy or who are post-transplant or who have an immune deficiency, are all at increased risk of getting severely ill from an RSV infection. We also know, and this is important to realize, that those who are in regular contact with young children are more likely to get infected with RSV. But what are the symptoms? We also know that the symptoms of an RSV infection might range from those of a common cold to difficulty breathing. So the symptoms might be very common symptoms like a stuffy or a runny nose, a sore throat, or they might become more severe with coughing or even wheezing. And finally, difficulty breathing, which you might notice when someone is unable to make complete sentences. And if it becomes very severe, it might lead a person to gasp or struggle for breath. If any of these signs appear, or if you have reasons to believe that your beloved or yourself is having breathing difficulties, it's very important to immediately see a professional. Thanks very much for your attention.